Good day, I am Sofia Michbi Ayay, and for today we're gonna perform a transpalpebral eye enucleation in dogs. The following materials include sterile drapes, scalpel number 3 handle with number 15 blade ideal for short and precise incisions, gauze sponges, curved Metzebaum scissors, Stevens stenotomy scissor or Mayo scissors. We need curved hemostats, strabismus scissors, tooth forceps, needle holder, suture materials, and Alice tissue forceps. We will also need clamps, represented by the colorful clips, to clamp the drape. So our pre-medication includes IV catheter 20 ml per hour. We can use analgesics such as midazolam and fentanyl. For anesthetic, we have propofol. For antibiotic, we have cefazolin. And lastly, we have to intubate the dog with sevoflurane or isoflurane. So the dog should be placed in a semi-dorsal or lateral recumbency aligning the palpebral fissures. So here I have made a clay model which represents the dog's eye. The first thing we need to do is to aseptically prepare the patient by clipping the area, placing fenestrated drapes, followed by clamps. Layer it with a 4-cornered drapes. Don't forget to clamp. Slowly inject a retrobulbar block into the space located behind the globe of the eye. The first thing we need to do is to close the palpebral fissure or the eyelids. So here I am closing the eyelids. Insert the needle close to meibomian gland openings or the eyelid margins. So a simple continuous 3 to 4 suture is commonly done in this area. After suture, using an Alice forceps, grasp the incised eyelid margins. I am using a number 15 scalpel blade and pencil grip to easily manipulate a circular incision approximately 4 to 6 millimeters from the eyelid margins. So a blunt dissection is done using a curved Metzebaum scissors, or this time I'm using Mayo scissors, deep into the conjunctival formices, globe, bulbar conjunctiva, until we reach the subtenon space, located between the sclera and the subtenon's capsule. So here we have the broad ligament clamp using a curved hemostat. Assuming that there is blood in the area, so we are to use a suction machine to collect the blood. So let's just pretend that this is a suction machine that is cleaning the area. Direct a perpendicular incision on optic nerve and repeat above for the lateral canthal ligament. Monitor the oxygen levels, vital signs, and blood pressure. So identify the orbital rim and cut using Metzebaum scissors. We can now then remove the globe by picking it up using a gauze, which can now be examined. We can now see the orbit. Pack the orbit with gauze for approximately 5 minutes and put pressure to stop bleeding. Remove the gauze by using a clamp and change if necessary. So remove the gauze and note for bleeding. If there is no bleeding present, carefully position a 2 to 4 chromic cut ligature deep into the optic nerve stump. Then lock it with a surgeon's knot. So in a closer look, we have to use a 3-layer closure. First, the anterior periorbital facial tissues using a simple interrupted 2 to 4 chromic gut sutures. This will help to eliminate the dead space, followed by the second layer, which is the orbital septum within the eyelids and is opposed with 3 to 4 chromic gut simple interrupted suture to tighten the area. And the outermost eyelid subcutaneous layer is opposed using a non-absorbable 2 to 4 simple interrupted suture. So this would be its final look. Wipe for any serosanguinous bleeding. To prevent infection and alleviate pain, the use of NSAID and antibiotic is necessary. So remove the non-absorbable suture 7 to 14 days after. So post-operative management include the wear of Elizabethan collar to prevent infection and scratching of the animal. That's all. Thank you.